And I was coughing a little bit this morning, and it's definitely from this poor air.
A plume of heavy smoke from forest fires has descended on Saskatchewan. Conditions in Regina, Swift Current, Estevan, and Saskatoon rated 10 plus or very high risk on the federal government's Air Quality Health Index. And it's not just harming people with pre-existing health conditions or who are very young or very old. When the air gets this polluted, everyone is at risk.
We were out for a stroll and we felt that we needed to sit because of it's harder to breathe for sure.
Even the Saskatchewan Roughriders chose to practice indoors rather than here at Mosaic Stadium. According to an expert that studies the effects of pollution and fires on lung health, the early data points to wildfire smoke posing a significant risk to all of us.
It's got all of the organisms that are in the forest. It's got all of the plants and pollens. It's got the microbes of a whole range of different kinds. And furthermore, when these fires approach a city or any town, really anything with man-made structures, then you start burning paint and plastics and metal. And that entire mixture is almost certainly more toxic than just the wood alone.
Repeated exposure to wildfire smoke could result in significant health problems.
If you have repeated irritation to your skin, eventually you're going to have scarring, and most people actually can understand that from experience. So the same thing can happen in the lung, and that's why we're worried about long-term exposures.
Environment and Climate Change Canada, as well as experts like Carlston, say it's better to avoid exposure to wildfire smoke. That means staying indoors and avoiding strenuous activity. If you have to go outside, wear a high-quality mask like an N95 to ensure particles don't get into your airways. Alexander Kwan, CBC News, Regina.